Hello everyone, my name is Dr. Ashwini Pisa and today I am going to share with you what is psoriasis, its causes, types, clinical diagnosis, treatment and management. Psoriasis is originated from the Greek word that is being itchy. Psora means itch and asis means condition, that is being itchy. Psora is long-lasting, non-contagious autoimmune disease which is characterized by red, pink, patchy eruptions on the skin. Psora is also described as chronic, proliferative, non-contagious, non-infectious skin disease which has genetic preponderance, that is genetic origin. Now let us see what are the types of psoriasis. Firstly, plaque psoriasis. Second, gutted psoriasis. Third, erythrodermal psoriasis. Fourth, palmoplantar psoriasis. And fifth, that is psoriasis vulgaris. Psoriasis vulgaris contributes about 90% of the cases in people. It is described as red, pink scaly lesions on the top, which are dry in consistency. Now let us see the areas affected by psoriasis. The areas affected by psoriasis are forearms, skin, navel folds, scalp, fingernails, toes, stomach, back and thighs. Causes of psoriasis. Firstly, genetic causes. Secondly, environmental and climatic causes. Thirdly, lifestyle changes. And fourth, non-steroid anti-inflammatory drugs. Firstly, the genetic causes. If the patient has any history of genetic preponderance, then patient can get psoriasis from his ancestors. Secondly, environmental and climatic changes. That is, cold weather, rainy weather can affect the psoriasis. Thirdly, lifestyle changes. That is, consumption of alcohol, smoking or any long-term use of the drugs can also trigger the psoriasis. Fourth is non-inflammatory drugs. That is NSAIDs. For example, if the patient has asthma and he is using the drugs for the long term, and any withdrawal of such drugs can also trigger the psoriasis. If patient is having anti-malarial drugs, if a sudden stoppage of these drugs can also trigger psoriasis. Psoriasis affects the structural layer of the skin, in which psoriasis acts on 9 genes. From them, psoriatic gene 1 located on 6p triggers the psoriasis in many patients. And on molecular level, psoriasis acts on T lymphocytes and then on inflammatory cells, that is TGF-alpha. And TGF-alpha, human genetic factor, is the main cause of psoriasis. By clinical diagnosis, psoriasis can be identified by auspice sign. That is, when we remove the scaling from affected part, it shows the glistening below it. That is called as auspice sign. Epidermal skin tissue affected by psoriasis inflammation often has many CD8 plus T cells, while a predominance of CD4 plus T cells makes up the inflammatory infiltrates of the dermal layer of the skin and joints. Now, what are the comorbidities of psoriasis? So, the comorbidities of psoriasis includes cardiovascular complication, depression and type 2 diabetes mellitus. Now, what is the prognosis of psoriasis? So, the prognosis of psoriasis is highly individualized. Most of the patients with the mild symptoms can be treated by topical treatment, creams, lotions and ointments. But the patients with major skin lesions can require oral therapies, injections, phototherapy, etc. Topical therapy includes creams, lotions, petroleum jelly, etc. for application of the skin on the superficial layers. Certain medicines in homeopathy include sulfur, graphitis, petroleum, etc. according to symptom similarity. Some higher treatment are phototherapy, that is Puasol therapy, but not safe in pregnancy, children and old age people, and also asthmatic patients. Here I conclude the topic what is psoriasis, its types, causes, differential diagnosis, pathophysiology and treatment. Hope you guys understood what is psoriasis, the skin disease. And if you are new to my channel, please like the video, share the video and subscribe. Thank you.